Hi there, this is Lori Edge-Hughes, and this is your four-leg rehab minute. And in today's minute, I want to talk about the things that you should think about with treating a diabetic patient. So, specifically, here's the background. I was part of an online senior dogs health summit and was asked to be some of the pre blah 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 panelists, right? A couple little chit chats and whatnot. And they wanted the topic to be about diabetes and how each of us would approach the dog with diabetes. And I thought, oh God, this is not my forte. I hadn't actually put thought into this, but hey, I've been asked, and so now I better try to come up with something that is like quasi intelligent. Anyways, so this is what I came up with, and I thought it would make a good little minute video. So, first off, and of course, as a physical therapist, I have to put the disclaimer that, for an owner, they should always check with their vet, especially if their dog is inactive and it's a new diagnosis of diabetes. Okay, kind of like, consult with your doctor before you go to the gym. Okay, good, got that out of the way. The other thing, and the thing that we should note as therapists or in canine rehab, is that the diabetic dog, or any diabetic, we need to realize that exercising can decrease blood glucose and therefore also boost the sensitivity to insulin. So if we are introducing an exercise program, it is that much more important to start slowly. Okay? Typically, recommendations for exercise and diabetes is one, aerobics every day, no less than 3 days a week. Okay, and it doesn't need to be crazy. It can just be going for a walk. Okay. Second would be adding balance exercises would be important. So, and if we're talking a senior dog, it doesn't have to be anything crazy. Nobody has to buy, a full assortment of peanuts and wobble discs. It could simply be balance, standing on land and doing 3-leg stands, going around the world, back leg, other back leg, front leg, other front leg, and balancing for whatever, see what the dog is capable of. 5, 10, 15 seconds holds per leg, and maybe do a couple rounds of that exercise. Okay, C or 3 or whatever, if I'm numbering, lettering, I don't remember how I started here. Weight training. So weight training can be good, building the muscle. So for our canine patients, this could simply be things like adding, specifically on purpose, adding hills or stairs to the exercise regimen. And whether that is then just purposely doing those, some of them in the house, encouraging the dog to come with you, going up and down stairs, good for everybody. Okay, or on the walk, finding a hill that both you and the dog, again, good for everybody, can do once, at least once, or a couple times during the walk. Okay, so that is mostly it from the exercise standpoint, and otherwise, knowing that it can increase insulin sensitivity and can reduce blood glucose, it might be worthwhile just to make sure you've got some snacks or some kibble in your pocket, so that if the dog seems to get a little bit dotty and slow, or out of sorts, that you've got kibble. Plus, it makes you popular with all the other dogs on the street. So that is it. Nothing really earth-shattering, but sometimes it doesn't have to be earth-shattering. Until next time, cheers.